In Andrefana, southern Madagascar, Fanja awaits the birth of her daughter. Like any expectant mother, she's excited, scared, and nervous about what awaits her. But for Fanja, a particular concern weighs heavy on her mind. Hospital workers will demand a bribe in the form of a gratitude payment when her baby is delivered, even though the service should be free. Out of fear of not receiving the care she needs and falling into debt she cannot repay, Fanja avoids going to the hospital. She is left with no other option but to give birth at home without professional medical support, a risk to both her and her baby. Fast forward 30 days and the deadline to register her daughter's birth is fast approaching. But Fanja knows she can't afford the bribe that would be demanded of her at the registration office. So she reluctantly watches the deadline come and go. Because of this, her baby has no birth certificate and no form of official identification. A few years pass and it's time for her child to start school. But when she tries to enroll, her lack of birth certificate prevents her from joining her peers. She has been locked out of formal education. Fanja looks on as history repeats itself, her daughter facing the same barriers to essential services as she has. Barriers she will carry with her throughout her life. Systemic corruption in the form of bribery, extortion, and discrimination reinforces inequalities by denying people access to the vital services they need and trapping them into a cycle of poverty for generations. This disproportionately impacts women and girls, as well as other marginalized communities, who are more likely to depend on essential public services. But it doesn't have to be this way. Anti-corruption efforts focused on marginalized communities can have a real impact to end corruption in public service delivery. Through the Inclusive Service Delivery Africa project, Transparency International works with communities, civil society, and local authorities to help break down the barriers that prevent people from thriving. In Madagascar, we are working to eliminate corruption around gratitude payments by calling for reform and accountability in the healthcare system. This includes an open dialogue with the Ministry of Public Health, regional health offices, and medical staff to push for greater transparency through clear price displays, proper receipts, and better complaint mechanisms. And where barriers to birth registration exist, Transparency International is advocating for more transparent processes, whilst working with communities to report any discriminatory or corrupt practices. Because public services such as adequate healthcare and formal education are not luxuries to be bought, but fundamental human rights for all. Together, we can fight corruption and create a fairer and more equitable future where everyone has access to the essential services they need.